So I'd like to warmly welcome you to the week one overview for the GRISP course. And this will be a much shorter presentation than the one I shared last week for the pre-course briefing. And most of this session will be presentations from you, from participants in the course. We realize this is just week one. Some of you are just getting started, but some of you have already posted your week one assignment. We'll be calling on you to present and to share today. So just some ground rules, and to get everybody started, if you could start by typing the city and country that you are connecting from into the chat window. So I'll start. I'm connecting from Geneva, Switzerland, and yeah, Douala, Cameroon, Buea, Cameroon. That's Helen and Samuel from different parts of Cameroon, Mohamed from Pakistan, Nancy from the USA, Tapas Sadas Sivan Nair from India, Alain from Haiti in Port-au-Prince, Mukesh from Sierra Leone, but currently in India, Oya Zeren Afsar from Portugal, Caroline from Kenya, Noor from Somalia, Adamu from Nigeria, Iyad from Oman, Ashut from Nepal, Pragath from, okay, Pragath typed their name, Calvin from Cameroon, Khalid from Nigeria, Esra from Aleppo, and so on. I'll stop now, but I hope this will give to those of you who are listening to the recording and preparing to do your catch-up task a good sense of the diversity that is in the room. I'm now going to lower everyone's hands because I think some of you are trying the button, but basically if you'd like to ask a question or comment during a presentation, the first way to do it is to actually use the chat. The second way is to raise your hand if you feel it's you'd like to speak, or this is better to say or speak about the issue you want to raise, and actually asking questions, making comments while somebody is speaking is both allowed and encouraged. So unlike a training room where you would want the presenter to be, you would want the room to be quiet while there is a presentation, here we can actually share our thoughts, our questions and comments while someone is presenting, and this is not just allowed, but this is encouraged. So do use that, and I'll be keeping an eye on the chat while doing my presentation and sharing and trying to keep up. Should there be a lot of people engaging at the same time. All right, so the agenda today, one very important point is that this is a last chance to join the course. And I mention this because some of you have registered for GoTo training but have not completed the other steps in onboarding, and they're not yet in Scholar. So Hannah, Dr. Hannah Kade, has been spending quite a bit of time following up individually with those of you who have manifested yourselves, but you need to let us know if you haven't been able to complete the steps. Some of you have joined late, and yes, and whatever the case may be, you'll find some resources in the materials panel of the GoTo Training Control panel. So you can see the agenda here, and I wanted to start with the very high expectations that some of you have shared in the community already. Some of the hope and enthusiasm and just the very good spirit with which many of you have expressed that you are approaching this course. The other question we asked in the community was with respect to how you're going to manage your time, and this is key. We know and we understand that you are busy working adult professionals. In addition, you also have personal lives. Some of you may have families, and there are many demands on your time. So we ask you in one of the updates, we're pleased to see many of you responding with very concrete plans for how exactly you are going to organize yourselves in the coming weeks to actually survive and succeed in this course. So very pleased to see this very specific plans, and if you have not thought through, if you have not yet blocked out slots of time in your calendar to work in the course, do not delay in doing so. This is really, really important, and making it a habit, being very consistent about engaging in the course is crucial. So I see some hands raised, but I'll maybe some of these questions, some of the questions you may have will be answered in the presentation, and then I'll go to you to see if there are still hands raised and questions to be asked. We are now in week 1. So week 1 is very much about discovery of the GRISP guideline and with some specific deliverables, and getting ready to and starting to think through the activity plan that you will develop, grounded or referring to the GRISP guideline. This was shared last week in the pre-course presentation, but I want to bring it up again because maybe it'll seem a little more concrete now that some of you have actually done these tasks. And obviously, your main task is to review the GRISP, to pull out elements that you will then use in the activity planning, but really preparing an update, which we're calling the week 1 update, to introduce your country of focus, and for which you have to select a transformative investment and then a number of strategies that relate to the transformative investment, and then the strategies you've prioritized. There are also some scholar skills that most of you picked up last week while we were working on orientation. Again, if you do not know how to navigate community updates, if you don't know how to prepare post an update, if you don't know how to complete your profile and connect with your colleagues, then my recommendation is that you make sure you watch the pre-course briefing and that last week's briefing, last week's discussion group, because there's a 33 minutes of tutorial really walking you through step by step everything you need to do. That may be easier than going to the various updates, but and maybe less time consuming. So now to give you a sense of what will be coming up next week, so the week of the 23rd of October, that is when you will be formally tasked with reviewing at least 3 updates and giving feedback to your colleagues about what they have posted. So this will probably be about a different country context. So you may ask questions about about the context. You may ask questions about the transformative investment. You may also give them advice or share your experience in responding to their updates. So that will be the task in the community, and then you will actually be starting your project in what is called Creator. If you remember from last week's pre-course briefing, there are 2 spaces in Scholar where you'll be working. So far you've been working in community. Starting on Monday, the 23rd, you'll actually receive a notification to start your project in Creator. So to give you a sense, also, even though this is almost a week away, this will be only on the 23rd, these are the instructions for the week 2 update. So basically, once everyone in the course has selected a transformative investment, posted an update in which they summarize these, then next week we'll be looking at each other's updates and giving each other feedback, and hopefully helping everyone refine their thinking about their transformative investment and the strategies associated with them. So the biggest portion of this course is about developing an activity plan in Creator. So we have not posted the updates related to that yet. We've only shared the rubric. And I'll be explaining exactly what that is in a second. But these will be the steps that you'll go through to get started in Creator. And again, some very specific instructions that you need to follow. Otherwise, you will run into many problems and you may end up with a Creator project that cannot be used in the course. So I cannot emphasize enough how important it is to actually take the time to view the tutorials and read the instructions for your Creator project. Now, what is a rubric? Many of you have downloaded it. You'll find it in the materials. The rubric describes what you need to write in that main project, that activity plan. So this will be your guide, your reference when you're an author. It tells you what you need to write, what needs to be in the plan. And then in weeks 4 and 5 of the course, you authors will become peer reviewers, and you will be using the same rubric to give feedback, constructive, useful feedback on how the authors that you've been tasked with reviewing, whose work you've been tasked with reviewing, may improve their drafts. So that is a very important concept, and what it is basically is a kind of checklist for what needs to be in the activity plan. Now within the rubric, you'll see that there are different criteria, and those cover format and presentation, the justification for the choice of transformative investment, the prioritization of the strategies, activity planning, and monitoring and evaluation. So along with each criterion, there is a scale by which you will be asked in weeks 4 and 5 of the course, so several weeks away, but we want to give you a sense of what is coming now, to assess the author's current level of work. So because this is peer review, you're not going to be assigning grades to each other or judging each other's work. The important part is not so much the numerical rating you assign as it is the explanation. So if you give somebody a 0, that's your prerogative as a reviewer. If you really believe that for a particular criterion, they have not done the job, but then you need to explain it and you need to help them improve. That is the key, is how you are able to usefully explain and give suggestions and guidance and share your experience in the peer review to actually, so that when they receive your review, they'll be able to act on it in order to improve their plans. So now, in order to prepare to draft your activity plan, you've selected a transformative investment. You're free to change your mind this week, after you've got, or maybe after you receive feedback from your colleagues, or after you spent more time with a GRISP, you can still change, but you do need to settle on one transformative investment that you will write about in Creator and 3 strategies. And you could also change the strategies as well, or reconsider some of them, or prioritize them differently. Then you'll view the tutorial videos to get started in Creator. You'll review the rubric, and then you'll set up your activity plan structure in Creator, and there'll be a video tutorial for the steps that require specific instructions to be followed. All right. So in your plan, and again, this is giving you a sense of what is coming rather than the immediate task at hand. For each strategy, which is where you stopped in the week 1 update, you'll identify 3 activities that you will then describe. So the justification for your transformative investment is important, how you prioritize the strategies and why, and then describing each activity is really the final part of the project that you'll be putting together. And then the monitoring and evaluation is also, I'm not sure what happened to the word improvement here. The monitoring of an evaluation is also a very important part of the plan, of course. Okay, there's some people reporting problems with the sound. I don't know. Okay. By the end of week 3, and I apologize because I see the dates here have not been changed. So I'll add those to the final version of the presentation. That's when you'll have to submit your draft for peer review. So that's to give you a sense of where we are in the structure and process of the course. And before we go to the questions submitted that were submitted ahead of the session by participants, I want to make sure to ask if there are any comments or questions at this point. I see Mohamed Miraz Salim has asked, is it possible that we come to know where we are standing, like meeting the assignments in time, like update what was required and how much we achieved till today? So yes, the answer is yes. There are many ways to look at, so I would invite you to click on the analytics button in Scholar. You have community, creator, publisher, and then analytics, and there you will see a lot of information about how you are doing. You might have to click around to make sense of what the graphs are telling you, but this is the most powerful way we have of giving you structured, giving you formative feedback as you're working on these tasks. All right, I see several hands raised, including starting with Suleiman. So let me unmute. Suleiman, how are you doing?
Fine, fine. Good afternoon.
Good afternoon.
Hello. I'm calling from Nigeria.
Welcome.
Hello. Yeah, okay. My own question is, the attention I need is these presentations. Is it possible we will get this presentation after the session? This is my concern.
That's a good question. Yes. So the presentations from the discussion group are always posted in the Scholar community. In addition, if you look in the Go to Training Control panel, there is something called Materials, and you will find an item called Week 1 Discussion Group Slide Deck. So that is also a way you can get right now. You can download the presentation that I am showing. You can download it right now and look at it at your leisure.
Okay. Then the second question and the last one is that you know, at times you use creator, the word creator, and you use scholars. So that two words confuse people. But I know creator is somebody that is writing, and the scholar is you are the tutors. That is the lecturers, whatever we call them here. Is it? Am I right?
Okay. So scholar and creator are the names of two of the tools we are using in the course. So we're not talking about people, but we're talking about a website which is called Scholar, which is where most of the coursework, of the course activities will take place. So I want to invite you to review the onboarding instructions. Let me just go to yes, and yes, so I am posting a link in the chat window, and if you follow that link, you will discover the first item. The very first item is to discover the 3 web services that you will use in this course. Now, Creator is the name of inside the Scholar website. Creator is where you will be developing your project. So it's important that you go review the onboarding instructions, and then make sure that you view the video tutorials so that you can make sense of these terms that we are using. Thank you, Suleiman, for your question.
Thank you, sir. Thank you, sir.
All right, let me now go to Caroline Mwangi Otieno. Hello, Caroline. Welcome.
Hello. Hello.
Hi. We can hear you loud and clear, and good to hear your voice.
Nice to hear your voice too. Sorry, I think it was a mistake. I did not want to speak at this time.
Okay. Well, so there is a little hand raised icon, and if you click on it, it's just like raising your hand in a training room. So you can also lower your hand. Let me go now to Mohamed Taufik Mashal and then to Guy Bokongo. So Mohamed, welcome. What is your question or comment, please?
Thank you so much. Actually, this was the same as my previous colleague. It will just happen by chance, but great to hear from you.
Okay, nice to hear from you as well, and warm welcome. How is your first week starting off?
Yeah, it was very nice. It was informative, also instructive from the course as well. So, in best of my understanding, I actually did the assignment and upload some of the information about the case of Afghanistan, particularly for planning.
Okay, great. Thank you, Mohamed. All right. Let me now go to Guy Bokongo. Guy, you also need to unmute yourself before we can hear you.
Yes, thank you. Hi, everyone. Can you hear me?
Yes, we hear you loud and clear.
Okay, good. Thank you. So I would like just to ask a question, because I saw that many of colleagues have already posted their assignment. So I just want to make sure I'm not late. just please tell me if this should be done before Tuesday, or we have I have up until Friday to do that, because I'm not really clear on that. That's my question. Thank you.
Thank you, Guy. This is a very pleasant problem to have, because so let me reassure you, the deadline is the one that has been posted, which is the 20th of October. Yes, for posting your week 1 update, in which the week 1 assignment, in which you you select a country of focus, a transformative investment, strategies, and then prioritize strategies from that. So you do have this week 1 to do it. We posted the assignment early and were pleasantly surprised by the number of people who very quickly posted their week 1 assignment. We do encourage you to take the time to review the GRISP guideline, but many of you also seem to have done so. So thank you, Guy. Does that answer your question?
Yes.
Okay, great. All right.
Thank you.
All right, let me go to Calvin now. Calvin, how are you doing?
I'm doing fine. Good evening. Hello, good afternoon, everybody.
Yes, Calvin, loud and clear. Go ahead, please.
Okay, I would like to ask a question. I wanted to know if I can ask a question concerning with one assignment.
Yes, go ahead.
Okay, concerning the transformative investment that were selected, I saw for some of the participants, they took strategies from that were not directly related or directly under the transformative investment they chose. Is it allowed? Is it is it the way we are supposed to do? I wanted to make sure to know what is the opinion of facilitators before going ahead with the work I have to do.
Yeah. Okay. So yes, we had this issue come up last year in the course, and in fact, you are not tied to the strategies that appear under specific transformative investment when selecting strategies. The key is for you to think about what is relevant in your country context, and that is that is the overarching concern that you are going to be trying to address. All right.
Okay, I got you. And the second one is there any way some can update the work they submitted in this update, or you need to submit a new update on the topic you choose?
So if you want to resubmit an update, yes, given that we have not yet hit the deadline, so you just need to click on the little red X to delete the current update, and then post a new one. Thank you to Calvin and others. Many of these questions have been covered in the onboarding instructions or in the various updates. So I suggest, and this is in response to several of the participants who are concerned about time, that those of you who have not yet made the effort to go through the instructions and follow them, you're welcome to stay. In 36 minutes from now, I'll be staying on an extra 30 minutes to try to help you, but ultimately you're going to have to spend time to make sense of this for yourself. And we do have 4 questions that were submitted by participants ahead of the session, which is what you were instructed to do, and this is where I'm going to turn to Jill Milbal from the World Health Organization to answer, so to provide answers or to address each of the issues raised by our 4 participants, and then we will move to oral presentations by participants, and that of course is the most important and interesting part of this group discussion. So I'm keeping track. I see there are many other questions in the chat window. We will be, I'll be posting a follow-up in the discussion group to make sure that everyone has their concerns answered. So Jill Mill, welcome and good afternoon.
Good afternoon, Vedat. Good afternoon to everybody.
Great. So we have 4 participant questions that were submitted before the session. And the first one is from Yousef al-Yaqouby from Palestine, who asks, how can we get the benefit and applying of the GRISP to our EPI in our countries?
Yeah, thank you very much for that question. Very good question. So I would say that our main objective of this course is that you actually apply whatever you learn here and learn from the GRISP document, as well as from interaction with your peers during this course to your country. And the way we have planned this course, we're doing it now in October, and it will finish by end of November. And most countries go through an annual planning process early on in the year or towards the end of this year. So we highly encourage you to apply these learnings and the projects particularly that you have chosen to see if it can be integrated into the annual plan next year. I hope that answers the question.
Yes, thank you, Jamil. Let's move to the next question. So this is a question from Mohamed Jama, who works for WHO Somalia. How can countries like Somalia, with no strong political commitment, totally dependent on donor support for EPI, plus other challenges such as security issues, how can they implement transformative strategies comprehensively?
Yes, this is all. Thank you very much, Dr. Jama, for this question. Very pertinent. And I think the situation that you described in Somalia is very challenging. And it's true, in such a situation, it's difficult to apply all the transformative investments, or even to apply one transformative investment comprehensively. We do recognize the difficult situation that you work in. However, we hope that you can choose at least one transformative investment. It could be an investment that is most needed based on your understanding of the country, or it could be an investment that you think would be feasible in this scenario. So although the situation is difficult, we are trying to do our best to be able to immunize as many children as possible. So try to find an transformative investment that you think can still be implemented, or the one that you feel that is would have the maximum impact. And then, in particular for Somalia, if you need support, if you want to discuss more in depth, we are happy to discuss with you separately, and I would even involve some of my WHO colleagues who have a bit more understanding about Somalia. So feel free to reach out to us if you feel you need some more discussion on this.
Okay, thank you, Jamil. The third question is from Khalid Abubakar, who is the national facilitator in Nigeria. He says commitment is his strength, and his question is, how does the GRISP team plan to share our selected transformative investment with our countries to possibly be put into consideration the recommendations and plans developed into our national plan?
Yeah, thank you very much, Dr. Khalid, for this question. Actually, you do have sort of the answer in your question. I think it's a good idea to share with the countries some selected transformative investments. We have not thought about it because in some of the participants from Nigeria are actually from Ministry of Health, working at the national level or sub-national level. But we could do it more systematically, so all the work that is done with Nigeria's focus can be shared with the country counterparts, the Ministry of Health people. That's a good suggestion. We could think about doing that. Similarly for other countries, and then also we could share it with other partners that are working, particularly in Nigeria. Share the transformative investment. That was something that we have thought. And then I would encourage you to directly reach out to your Ministry of Health colleagues and say that you've attended this course and this is your idea that you would like to have included in the national planning process. And we'd be happy to help you going forward because really success for us looks when you are able to take your project and then make a change in the country. So we'd be happy to support you take this project forward.
Thank you, Jamil. Last question submitted ahead of the session is from Oya Zeren Afsar, who is a public health professional currently based in UNICEF in New York. His question is it meant to be adapted into the regional context to better fit in the situation and requirements of different regions, just like what happened with the global vaccination strategy, the GVAP?
Yeah, thank you, Aya, for this question. Absolutely, yes. That's why we have this course, because we really want, the countries to actually adapt the GRISP document and the strategies to their regional and country context. So it's absolutely essential that you think about the situation in your country, or even going subnational in the region that you are working on in, and then adapt the risk document based on that and your strategies. In fact, in your justification, you should mention why you chose a particular transformative investment and how maybe you plan to contextualize it.
Okay, thank you. All right, so we encourage you to submit questions, and you'll find an update in which we explicitly ask you to submit questions ahead of the discussion group. This is more useful than asking questions during the discussion group on the spot, because if you ask your questions ahead of time, we'll prioritize them. If there are things that you should be able to figure out on your own, we can let you know that before we use up the precious time in the discussion group, and we can follow up appropriately. So I just want to go back before we jump into the oral presentations. I do want to answer a few quick ones. One from Jani. You mentioned that we have a choice to change or revise transformative investments and strategies. So the limit for that is basically the end of this week, as that is when, basically Monday the 23rd, you'll be starting on your creator projects. You want to make sure that you finalized your choice of transformative investment and strategies by before you start on that creator project. It'll be more difficult to change later. Let me see. I saw at least one. Yeah. Does one have to focus on the country where one lives? That's a question from Alex Ajagba. No, but you will be expected to have documents, resources, information, data about the country that you're going to be writing about. The course team will not supply you with that information. You'll need to bring it to the table, to your project. So do make sure that whatever your country of focus is that you choose, that it is in fact one where you have sources of information sufficient to, in relation to the rubric that defines what you'll be asked to describe in the context, and just to make sure that your project actually makes sense in the specific country context. Yeah, so I see some other questions which will follow up on the missed opportunities and other issues. Yes, there will be more people from WHO, more contributing on different topics, and yeah, I see that Alexandra, who we have not heard from yet, but welcome, Alexandra. You'll need to unmute yourself. And I believe you wanted to add a point about the Somalia question. And the sort of
yes, indeed. Hello. Yes, I wanted to add that, again, to our colleague, the safe way to go is again to look into the CMYP, which Somalia in its very complex situation actually has, and particularly in the zonal section of CMYP or in health sector strategic plan, which does exist in the country and which really lists the distribution of EPI activities, major EPI activities, as per different NGOs, UNICEF, local health authorities, and indeed WHO in the country. So you can find very nicely there where you can fit in your transformative investment and how to transfer it into actual practice. I just wanted to add that. Thank you very much.
Great. Thank you, Alexandra. And thank you for the participants who have submitted many questions. We'll make sure we'll follow up on everything that's in the chat window. If we're not able to do it now, we do want to move to the participant presenters, and we had 5 individuals. Now, many of them also asked questions, which is why you're seeing their name again ahead of the session. Do pay attention to those updates to prepare for the discussion group. And so we have Alain, Blaise, Tatsinkou, Yousef yaqouby, then Khalid Abubakar, then Calvin Tonga, and then Oya Zeren Afsar. So without further ado, you will see a timer on your screen, and you will have 3 minutes to orally present in response to these 3 questions. What is your selected GRISP transformative investment? But really what we're interested in is why that one drew your attention and why you've selected it. How does it apply to your country context? And that is the second question. And then 3, what are the 3 to 5 strategies that you've prioritized? And again, how have you thought through the prioritization that you'll be, the prioritized strategies that you'll be presenting. So with those questions in mind, I'm pleased to introduce our first presenter. So he's been very active in the community. Alain Blaise Tatsinkou is a solution-focused public health consultant, and his country of focus is Haiti. But I'm going to now unmute his microphone, and you'll also, okay, Alain Blaise Tatsinkou, welcome.
Yes, welcome, Rida. Good morning. Can you hear me?
Yes, indeed, loud and clear. So without further ado, I am going to start the timer, and you have 3 minutes to tell us about your transformative investment in your country context.
Right. Okay, thank you very much. In fact, I have chosen the community involvement as a selected transformative investment because I know the context. I've been working there for more than 3 years. So, like I was saying during the last when we were writing the CMYP 2016-2020, we do work on a 9 transformative investment, but we didn't go much deeper in the communication part of that. And then we know that it's something really important for the country at the moment because we really want the community to have the shared responsibility of immunization delivery. And that is something that goes beyond immunization, but the entire health system. I think that the community is the stakeholder who has not to really actively involved. That's the reason why I think we should multiply our strategy to make sure that, in fact, they are involved because they are the most beneficial of what we are doing. So that's why I choose it, knowing the context and then know the possibility that the API program can gain from that. And we were having like a set of 7 strategies. I have to go quickly. First, the big orientation was to engaging the communities and creating the demand for vaccination. That's the most important. The demand has to come from them. As soon as we reach that stage, we will better our coverage because as you see in my test, what I was saying is like since a couple of years now, the coverage is not evolving. All the indicators from VPD surveillance and immunization, the routine one, they are going down. Despite we are working a lot to try to remediate to the situation, but somebody is missing out, and it's the community. So we want to mobilize the community. We want to mobilizing and communicating for vaccination. Really important. We have the tool for that. We have technology. We can use the technology with that opportunity without really big cost to try to, you know, to disseminate messages, to disseminate what we want from the community and get them involved in this immunization activity. I think that we are all gaining from that. And you know, we are getting we have a lot of type of vaccine now, and making sure that the existence, if they occur, are really addressed, which is really important in vaccination. So we want to establish a national IFE review committee to be able to rapid and trustworthy, and that is really important. But when it comes to choose the 3 from the 7 strategies, I focus on ensure good interaction, collaboration between community and immunization services. And then the second one was to develop immunization information for use in school and training college. And the last one, use social media and mobile technology to promote immunization. Those one has of explanation. I think that I will share that on the website because the time is over. I have to make sure that I...
Thank you very much, Alain. We do have some questions for you in the chat window. I'll start. I think some of them have been answered in your presentation, but you know, from Tapas Sadasivan there, how significant is vaccine hesitancy in your country? That's one question. And then Mohamed Mira Salim asks how to ensure good interaction and collaboration with communities. Do you mention any activities for this strategy? And then Jani wants to know how widespread is internet connectivity in Haiti? Pankaja wants to know the percentage of immunization coverage, and Alexandra has a comment. Do not forget that you have to develop AEFI surveillance system and encourage reporting so that your AFI committee would fulfill its purpose. Akachi also wants to know how will you ensure good interaction and collaboration between communities in Haiti. So let's stop now. There are more questions flowing in. Are you able to give us a synthetic set of short, concise answers before we go to the next presenter?
Yeah, sure. Thank you, colleague, for the question. And that's really, I will start with the first one. Can you remember the first one? Because I think that is kind of resuming everything. Yes, the vaccine resistance that is really important. As you know, we faced since 2010, after the earthquake, we have here faced the cholera outbreaks. And with the partner involvement, we do have vaccine from the ICG group, the cholera vaccine that we were giving to the population. And you know how difficult it is to get that vaccine. And we face major resistance from the community. They didn't want the vaccine, despite the outbreak was killing people. And that was a major concern. And that's when we realized that it's really important to communicate with people. Even though they are suffering from a disease, they will not demand if you don't reassure them that the vaccine is safe and that they have to take the vaccine. So that is something that's really important. For me, we have to communicate with the community, not only when we have outbreaks or like we are doing SIA, but in a routine base. That is really important to be communicating with them, routine base, find out solution, creating like committee, and then I will develop everything with an activity. We see that we need to first set up a national committee, a local one with all the sector involved, coming from the community, and there will be advocacy inside the community, and then we will help them with the tools that we have. And we bear in mind that we have technology. We are happy to see that technology is booming. We have mobile phone, we have social network, we have, and then we use all that to spread, to disseminate, to educate, to exchange, to talk with them, to give them their voice, to let them raise their voice, to see what are they stating, what is happening on them, because as I say, they are the main stakeholder.
Thank you, Ella. All right, we have not gotten to all of your questions, but we will be sharing the questions. We'll be pulling out the questions and sharing them with the community, and Alain will be, we would would be very productive follow-up to have your answers to these various participant questions. So let's now go to Yousef Al-Yaqouby. Yousef, are you able to hear me, and can you speak to us?
Yes, I'm hearing you. Are you hearing me?
Yes, loud and clear. All right.
Thank you. Good afternoon.
Good afternoon. Good to hear your voice. So you're the EPI manager at the Ministry of Health in Palestine, and your country of focus is Palestine. Your transformative investment is the information system. So these are your priority strategies on the screen. I'm going to start the timer, and the floor is yours.
Okay. I choose this transformation investment because, as you know, Palestine consists of two separate areas, West Bank and Gaza Strip. There is no geographical connection between these areas because Israeli occupation. So the flow of data has some difficulties, especially the management and data collection. And the main caregiver in Palestine. Two main caregivers, UNRWA and the Ministry of Health. There is a connection between them, but some difficulties in data collection and flow of information. So this investment can help us to face these errors and to overcome these. The errors can be facing us. Applying these strategies can help controlling data and managing, monitoring the program. Technology, we have some technology, but software, especially for immunization, we have not till now. And vaccine surveillance or vaccine preventable disease case surveillance, we have a weak point in this section. We are looking for solving and overcome these problems. So I attended to this course.
Okay, thank you, Yousef Al-Yaqouby. All right, and you're finishing ahead of time. So there are some questions here in the community, in the chat for you. Noor Ali Mohammed asks, do you have adequate human resource, particularly district management teams, those that can take timely data analysis and take action on a timely basis? Otherwise, you need to focus on building management teams first. So that would be a suggestion, depending on your answer to that question, for selecting a different transformative investment. Tosin Orhor Hamreru asks, could you share strategies being deployed to increase accuracy and reliability of data? Is there facility-based electronic medical records that help to track this? Adamu Ibrahim asks, considering the security situation of your country, how sure are you that you will achieve the desired objective of tracking each person's vaccination? Acute Shrestha says, good presentation, Alain. So referring back to our first presenter, sharing a concern about the sustainability issue with using social media and mobile technology. Emmanuel asks, is Yousef seeking to develop an electronic child health register or e-health for all tools? Helen wants to know if you're going to computerize the data. Tsegai Gute says, what does EPI data quality look like in Palestine? Aden, how can you address data accuracy and reliability if data collection is a challenge? And a comment from Alexandra Karik from WHO, advantages of immunization registries are many, however, a lot of groundwork to be done. Make sure to define scope and objectives before its development, and maybe consider the starting point also designated to expand. And just so you understand, I'm reading these chat messages because people viewing the recording will not be able to see the chat necessarily. Bashir Ahmed, planning is the mother transformative. Try to plan thoroughly. Mimi asks a question that's been asked by other participants: do you use electronic health records? Are you planning for ODK to end user? Paul asks, what challenges do you envisage in Palestine to assist you in investing in an information system? Bebe wants to know if there's a strong manual system at health facilities in Palestine before automation. And Mohamed Kulufara asks how health system is working in your country, because as my knowledge always is fighting, and what is the default rate? Okay, Yousef, that's a lot of questions. It would not be reasonable to expect you to answer all of them, but would you like to, what seems important to you to clarify for your colleagues so they understand the situation that you are facing and they understand your choice of transformative investment?
Yes.
Go
Hello?
ahead, Yousef. Yes.
I didn't hear the last thing.
So that they understand the challenges that you're facing, what is important that you would like to share, so that they understand why you have selected this transformative investment. And if there is any short points or responses to address the questions from your colleagues. And
yes, I will answer all the questions from my colleagues about the situation, and we are living in Gaza Strip and in Palestine as all.
Okay, thank you, Yousef yaqouby. So again, we'll be sharing these follow-up questions. We'll find the useful way to put them into the update for the discussion group so that the conversation may continue. We have many more presenters, and again, we will be, as some of you have shared, making our best effort to get through the the logistical issues for the course so that we can get to these presentations and hopefully have more time for discussion after each presentation. But again, very impressive the number of questions as well as their quality. So we're now going to go to Khalid Abubakar. So let me find you in the chat, and unless I'm missing something, I don't see Khalid Abubakar in the chat. And yes, Mohamed Salim, that's what we'll collect the questions and ask the presenters to follow up on them. All right. Okay, so let's go then to Calvin Tonga. And Calvin, welcome. You are an EPI M&E officer in Cameroon, and you're hoping to have a good time. So before we start with your presentation, are you having a good time today?
Yeah, very much. I really enjoyed the meeting of today.
Great. All right. And is there anything we can hear voices in the background that are quite loud, and that will probably make it difficult to hear you when you are speaking? Is there any way at all for you to move or to use to reduce the noise level before I start your timer? Okay, great. All right, so let me start the timer, and the floor is yours for your country of focus, which is Cameroon.
Is it better now?
Yes, yes.
Hello, is it better now? Are you getting me better now? Okay.
Yes, I'm starting the timer now.
Okay, thank you very much. The transformative investment that we selected is invest in tailored strategy that identify undervaccinated and unvaccinated persons and regularly provide them with vaccines they need. In fact, since 2013, when Cameroon performed its best immunization coverage, that is 88.6%, we've been struggling to get to that performance again. And from experience of routine immunization surveys and also National Immunization Day post-event coverage surveys, we came and found out that many communities that are being missed during vaccination activities are almost the same for various reasons. And the situation in the country, you have some communities that are hard to reach because of security problems. Some also who are living in remote areas, geographical accessibility is not always granted for her workers to get them covered. So we thought this transformative investment, if well developed, will help improve on our immunization coverage and ensure equity for all.
I'm no longer able to hear Calvin. Can other participants confirm in the chat if you're also having trouble hearing him? Okay, Calvin. Yeah. We can no longer hear you. Yeah. All right. Well, this happens, and this is part of the this is part and parcel of connecting with people from all over the world. Calvin, we lost your audio for about 30-45 seconds, so I'm going to give you some extra time on the timer. Could you, yeah,
thank you very much. Are you getting me better now?
Yes, now we're able to hear you, but you were cut off for about 30 seconds.
Okay, let me start at some point so that those who did not get me can listen. So what I was saying is that we choose a transformative investment that we choose is invest in tailored strategies and that identify under-vaccinated and unvaccinated persons and regularly provide them with the vaccines they need. So the country, when we did the analysis, we saw that since 2003, we've not been able to get to the immunization coverage. We got that is 88.6%. And for many various reasons, one being that some communities are hard to reach because of security problem, because of infrastructure, difficult geographical access, or because of behavioral behavior, especially those who are nomads in the northern part of the Cameroon, and some population also are living in islands and isolated area. So we thought taking them into account is very important for us to improve on our immunization coverage, strengthening the ongoing immunization activities in health facilities. So the priority strategies that we identify was to identify and examine reasons for unvaccinated and undervaccinated. This should be done at the level of the district to be more specific. And once done, the results from the analysis should be taken into account when updating microplans to ensure that all communities are included and targeted within session plans. And this will help ensure equity in vaccination coverage. And the third issue is to revitalize and provide adequate resources for outreach activities, because the analysis of the activities in the country shows that we have low or insufficient implementation of planned outreach services. So we think if we go through this transformative investment could be beneficial for our country in order to increase our immunization coverage and get the targets that we fix in our multi-year plan. Thank you very much.
Thank you very much, Calvin. All right, we have I see many questions in the chat. Again, we're going to find a way, and this will actually be what you'll be doing in week 2, is looking at 3 of your colleagues' presentations and commenting on them, giving them constructive suggestions, advice, sharing your experience, exactly as you've been doing so well in this discussion group. So unfortunately, we're not going to be able to get to our last presenter, because I'd like to ask Jill Milbal and Alexander Karik from WHO HQ to share their thoughts and considerations with respect to the presentations that they have just listened to before we close the session and move to the technical support in a couple of minutes. Go ahead, Jill Milbal.
Yeah, thank you very much, Reda. I'm very pleased with the direction the discourse taking, and the presentations today show that people have really thought about what might be the most pertinent transformative investment to work at the country level. And I just want to remind again something that Alexandra mentioned earlier, is that it would be great at this point that if you can already look at the data from your countries and the important documents in your countries. So look at the strategic plan, the annual plans, the CMYPs. That gives an idea of what the country has been planning, and see if where this transformative investments could fit in, or if there is a gap. Maybe that is the justification for doing some additional work, but also do refer to those planning documents that are available in your country, as well as the health systems plan, if you can have access to that. In addition, there are several reviews done in the countries often, which point to different systemic problems, and that would be a good starting point to decide which investment to focus on. Thanks very much, and I look forward to presentations next week.
Great, thank you, Jilmil. Alexandra, would you like to share?
Yes, indeed. I was very impressed with the presentation of our colleagues, and in particular, Calvin, who was mentioning focused approaches and investment in tailored strategies. I think that's a very good start. I do not know whether any equity studies have been done in Cameroon, but that is certainly something to look into in order to understand better the barriers to vaccination that we encounter, either gender-based or geography or wealth. We have to keep in mind that coverage overall can increase, but inequalities between households, between locations, between rich and poor can actually worsen. So in order to avoid that, and especially when we reach certain level of coverage, I think really the way to go is to invest in tailored, in focused strategies to identify clearly those who are un or under vaccinated, and that's the way to reach those critical key susceptibles that are left. I am sorry we haven't heard our colleague from Nigeria, and yes, regarding the immunization registries from our colleague from Palestine, I would just once again like to underline that that's a great idea, because this is the future we live today. We are living in the time of high technology, and immunization registries can really have great advantages, not just to identify who is vaccinated or who is not vaccinated, but you can also monitor your birth cohort. You can monitor your you can have inputs in your surveillance system. You can follow your transient or nomadic populations. You can identify easily your vaccination dropout. So really that there are numerous advantages to it. However, like with any database, your objectives should be established prior to the development of the registry, and of course one should start with the assessment of the situations and then explore different options for the system development, and of course not to forget the maintenance of the systems that we usually forget to put in the budget. However, great start. Thank you very much. These were my very few comments for today. Thanks.
Great, thank you, Alexandra and Jilmil. So this brings to an end the mandatory weekly discussion group for week 1. Thank you all for your excellent participation, and both congratulations to the presenters and to all of the participants who contributed to the discussion. Now you know how it works. We'll have more and more time as the weeks go by for your presentations, for your feedback, for your discussion, as we work through the different stages of the course. And each time we'll be focusing on the task at hand, so that this discussion group will hopefully help you with the work that you have to deliver on in the community and in creators. So now, as you can see, I've shared my browser. You should be able to see my screen, and you should recognize by now we're going to spend the next 25 minutes looking at the exactly where you're supposed to be today with respect to the course, and then really to address any burning questions for the 9% of you who are lost or confused, to try to lift the fog for you. And again, if you need to go and you feel comfortable already in Scholar, then yes, by all means, you're free to go. But if you feel like you need support, or whether or not you have a burning question or just want to make sure that doing okay. You're welcome to stay, and I'll be staying until past in order to give you additional level of support. So let me just ask to see if there are any burning questions. And I know Rizwana is one of the people who has been struggling with account registration and exactly where to go and where to find the information that's needed. So yes, all right. So let's go to Khalid Abubakar Aiza. Yes, Khalid. What is your question or the problem that you're facing? Okay, this has happened before, I think. Yes, so let me go to Abebe. Abebe Kasahuna Fe work. Hello, are you able to hear? And what is the problem? Yes, Abebe, good. Good to hear your voice. How are you doing, sir? And what is your question for this technical support session?
Thank you. My main question is, how can I meet my assignment to present on the next week discussion in advance, like our presenters today?
Okay, thank you. Any other questions? So let's see, Mohamed Jama. Yes. So I'll be answering that question in the walkthrough. I'll be doing once we've checked into some of the questions. So Mohamed Jama, you also need to unmute yourself. I see you have your hand raised. So I'm assuming that's because you have a question or a burning issue that you'd like help with. Go ahead, Mohamed. Okay, it sounds like... Okay, so please do not raise your hand unless you actually need support. And Caroline, please go ahead.
Yeah, for me, hello?
Yes, yes, Caroline, go ahead. We can hear you loud and clear.
Yes, I just wanted to find out for the next assignment, just a bit more clarity on how to use the creator.
Okay, I'll be covering that as well. Thank you for that question. And then Mohamed, so we have two Mohameds in this session. Mohamed Kulufara, I've unmuted you. You'll need to unmute yourself as well in order to speak and ask your question or share the problem you're having. Okay, it seems like you've gone. Okay, Rizwana, and we've heard from you, so I think your concerns will be addressed by the walkthrough. So Sebastian, go ahead if you'd like to unmute yourself. Otherwise, we'll just dive in, and I'll be keeping an eye on the. Yes, Sebastian.
Yeah, hello, hello, Radar. Hello.
Yes, go ahead, Sebastian. We hear you loud and clear.
Okay, thank you very much. So I've been having challenges connecting to this. So this is my first time, and I see that I'm not able to complete my onboarding yet because I'm not able to log on to Scholar, and I can't contribute to assignments or group discussions. But today the audio has been great, so I've been able to hear all the discussions going on. So I don't know if you can take me through that so that I can actually be able to go into Scholar or to go into community and then make some posts and respond to other people's contributions as well.
Okay, so yeah, I can do even better than that. I'm sharing Dr. Kade's WhatsApp, and you can reach out to him and he'll do the one-on-one support if you don't get what you need from this session. All right?
Right.
So I think some of you may be late joiners who have not yet gone through the onboarding instructions that you're seeing on screen now. So there are 5 steps, and then there are sub-steps within each of the 5 steps, and you do need to complete all of them. So we're still getting questions about, what is Scholar, or how do I sign up for the Tuesday discussion group, or and those questions are answered here, and I can tell that some of your colleagues who've been diligent and carefully following instructions and getting their tasks done may be a bit frustrated with these recurring questions that have already, if you follow the instructions, you will find the answers, And if you need help, help is available. But do keep in mind that some of your colleagues have worked this out for themselves. It's okay if you need support. You may want to contact Hannah privately if it is a question related to onboarding. So I'm just going to show you the page. And again, this question of how you register in Scholar, you know, that some of you seem to be stuck on. There are some steps. The most important advice is actually right here. Let me see if I can find it. Yeah. So that we recommend that you write down the name, surname, and username that you used, as well as the email and the password. So that's 5 pieces of information. If you're missing one of them, you won't be able to log in again, and then you'll run into trouble. You also need to check in your inbox that the that the confirmation mail to activate your account has arrived, and click on the link once you found it. This is all explained in great detail in these tutorials. This one, for example, on creating your account is 3 minutes and 16 seconds. So you take 3 minutes of 16 seconds to watch the video, and in many cases that will save you from hours of problems having to connect with Hannah for individual one-on-one support, or staying around for 30 minutes for this session. Yes, so I do encourage you, when you see a video tutorial, to look at the tutorials. And I do see the message from Khalid Abubakar, and I apologize because I did not see your name. That was a mistake on my part. So we'll make sure that you are the first presenter in next week's session. Apologies for that. We do try to be fair. We ask that you put in the effort, and so many of you have already. So again, to go back to this onboarding business, it's all here. You just need to follow the steps. Again, if you do need help, reach out to the WhatsApp number, which is Hannah is really standing by. If he doesn't reply right away, he will, and follow up. Yeah. So for Joseph, yes, you're all muted in order, because so many of you have background noise. And let's hear from you, Joseph. What is your question or concern? How can I help, and how are you doing? Yes, hi Joseph.
I'm doing good.
Loud and clear.
Yeah,
Great,
hello.
thanks.
I'm doing good. And you too? Hello?
Yes, I'm fine too, thank you. What is your question or concern?
Yes, in fact, I had network challenge. I joined in late. I wanted to find the process that one requires in order to make a presentation.
Okay, so you joined late, Joseph. Many of your colleagues made the effort to be on time. So I would ask that, out of consideration for them, you go to the community. Within the next day or two, you will find the recording of the session that you were unable to join on time, and you will be able to watch the recording of the session and catch up on its content. Great, thank you, Joseph. All right, so as you know, this is where it all starts. So if you haven't been here yet, you may want to review the onboarding instructions, and you should have created your account by now. So I'm just going to log in. Just make sure. Yeah, and I'm going to log in with a personal account, not my administrator account. And also about for late joiners or people who haven't, if there are any of you participants who are active, who are up to date, and if you'd like to help them, do reach out to them. You can use the chat window to send them a private message. We encourage that very much, of course. So I am a course participant. I log in and I see my personal profile. I have not added my picture, and as you could see in the PowerPoint in the slide, when I was presenting the slides, the presenters, only a few of them had their picture, and that was unfortunate. So there is a tutorial by which you can add your picture. Here in the left-hand side, you will see the list of communities that you are a member of. So of course, I'm a member of many more communities, and in fact, of so many communities that I don't even see the GRISP WHO strategies course here. So I'm going to have to view all. And now here we go. I can see that I need to accept the invitation. So this is from a previous tutorial, but you should already be a member. So what you should see once you have joined the community is you should see this little icon, and then you click on it, and that takes you to the community. Any questions about this so far? Is anyone lost? If you can let me know in the chat. But I think this should be, yes. Now, by default, the community looks like a mess. You can see many different things happening. You can see comments, you can see people still joining the community. And so there's a lot happening. How do you find what you actually need? That is the question, and how do you find it quickly? So I went through this last week, so some of you may, but there are some new participants, especially late joiners, so I'm going to show you, and I invite you to view the recording, but I know if you're, yeah, so I do invite you to do that, but I will be sharing some new things for week 1. And so here, I'm going to go to updates, because what I want to find are the updates from the course team. And then I'm going to go to filter updates, and I'm going to filter to show all activity from the admins. And as soon as I do that, here in the center window, I can see all of the updates from the course team. So if you're a late joiner, what you're going to want to do is scroll down to the bottom, starting with the honor code. And you just click on each update, read through it, identify, are there action points, that things you need to do, tasks you need to complete, and then you can move on to the next update. So in this one, this is the honor code and the participation guidelines. Really the takeaway is that your work should be your own, and we are sharing community assignments. So everyone is sharing their work with the community. That means you should only view updates from the other participants once you have posted your own. All right, so that's update, the first update. Then you're going to work your way up, and I did this last week, so I'm not going to do it again, but basically each update calls for you to do something, shares a resource, one or more resources that are going to be used in the course, and in many cases includes a welcome message, in this case starting with a welcome message from the original author of the GRISP guideline, Rudy Eggers. So each of these orientation week updates includes a welcome message, and then also includes a tutorial that shows you how to start working in Scholar. So yes, so you go through each update. Each update should take you no more than 30 minutes to complete. But that means that if you did not do your orientation tasks day by day, you now have 5 times 30 minutes to get through all of them. So this is why we have put together a catch-up guide. And if you want just the sort of the executive summary, okay, I'm going to show you where to get that. So first of all, it's available in the materials panel. You'll see week 1 catch-up guide. It's a half-page PDF, and it includes a number of links. So you should follow all those links. I'm going to see if I can show you what this looks like. So let me just see if I can bring it in here. Yeah. So here you have the week 1 catch-up guide. You have the links to the 4 community updates. You have the link to the onboarding instructions. You have the link to view all updates from the course team. And that link you need to save or bookmark or do whatever you do to make sure that happens. And then here you're going to, the deliverables for week 1 actually start with a download and review of the rubric for your creator project. And I'm going to explain what that is exactly and what that looks like. Second deliverable for this week is actually attending this discussion group. So if you're here, you can check that one off. And then if you're not here and listening to the recording, then you do have to complete the catch-up task and confirm that you viewed the recording. And then you have the week 1 community assignments. Now the resources such as this catch-up guide are available in the community shares. So let me go, where are the community shares? Let's look around. So you start with the left-hand column. You can see send a message. This actually sends a message to the entire course team. So you only want to use this if you're sending a private request or comment. In most cases, you're actually going to want to use the comments in the community to share your comments with everyone. Whoops, let me just, wait. Yeah. So this shows you the members of the community, shows you the keywords linked to the community. On the right-hand side, you have some interesting stuff. You have recent activity. So this shows you everything that has happened recently in the community. So you can use that to sort of catch up with what people are doing in the community. This is different from actually looking at what the course team has sent your way. So if you're short on time, start by looking at the latest updates from the course team and then move on to the other stuff. Now, originally we started out looking for the shares, and guess what? They're right here in that right-hand column. So yeah, what you want to do, you have the latest 4 shares. So you want to click on View All to see all of them. And these have been carefully chosen to actually help you in the course. So the first one you see is the week 1 catch-up guide I mentioned and just showed you. The second one is the actual GRISP activity plan rubric. If you were in the discussion group, you now know what a rubric is. Basically, it's the project assignment. This is what you're going to be doing and working on for 6 weeks, is using that rubric to build your activity plan informed by the GRISP guidelines for your specific country context. So the GRISP prioritization tool and all of these other things here, you will put to use, and they're referenced in different updates. So to go back now to what are your main deliverables, one was to prepare for the week 1 discussion group, and if you're here, you've done that, but you have 2 others for the first week. You want to get to know the rubric for your creator project, so you'll want to download this, and you have some information explaining again what the rubric is. And so to give you a sense, I'm now going to go through that, and hopefully in more detail than I did in the presentation. So here you can see this is a 6-page document. It explains the activity plan development process, and then explains what is a rubric, what's a criterion, and so on. There's some guidance for authors, some guidance on how to get started, and then there's the actual rubric itself. So what you need to do in weeks 2 and 3 of the course is right here, is spelled out here. And then each of these, this is a criterion for general format and presentation. So as you're developing your plan, you can refer back to this and ask yourself, well, is my narrative clear, well organized, and concise? Is there anything I can cut out because it's not directly relevant? And then you can also self-evaluate your work. Ask yourself, well, is my format and presentation, where am I? I'd like to have something that's excellent. Where am I in that process? What do I need to do by the deadline to actually make that happen? Then another part of the rubric is to prioritize. So you have your strategies, and you have to summarize the prioritization process through which you selected 3 strategies. And then you have to explain why for each selected strategy it was selected. Yes. And then again, you have a set of ratings that you can use to self-assess at this point, and that you'll use in peer review to actually review the work of others and give your constructive advice and suggestions and recommendations to others. The next part of your activity plan, and what you'll be starting on in week 2, is the activity planning. So actually at the activity level, building a table and then filling it in with the details of the activity. And last but not least, of course, is the M&E section. So that also will be part of your activity plan. And in the orientation week, we shared with you the structure of a sample activity plan that just to give you a sense of what is the main course project that you are going to be doing. So what will happen on Monday is that you will receive a notification. So you can see I haven't checked into this account for a while, but I have 33. I should probably go in there and look. But on Monday, you will have one notification Oops, I'm having trouble navigating here. Yeah, so you'll be able to go into notifications and you will find a notification that looks like this. So, which is called a work request. So a work request, actually I should be able to find, okay. This is a work request for another course, which is called the ambulance course. And this, of course, you will get a work request for the GRISP activity plan, and you will find it in notifications, and you'll be able to start your work by clicking on the Start New Work button. Do not click on Use a Work that you have already started, and this will be the first time that you will start working in Creator. So I'm not going to give you, we'll do a much more detailed walkthrough next week, but this is Creator just to introduce this workspace. So this is a space for writing. Yes. Yes, this is where you will begin to put together your GRISP work plan. One caveat: one person has already tried to paste complicated formatted text from Word. That will not work. In Creator, we keep things simple. And so that means simple text, and if there are any tables, such as the activity table, you'll want to use the Creator table tool. You will not be able to paste tables or other or graphical elements into Creator from Microsoft Word. So there will be, and we'll explain that in the video tutorials. All right, so that's actually what we'll be doing 6 days from now, when you receive the notification. So here, of course, the description and the other aspects are for the for another course, but you will see the description for the project that you have to build in Creator, and you will be working in Creator up until you submit your project, and then weeks 4 and 5 you'll be actually peer reviewing the project of others in Creator as well. So in addition to seeing your own work, you will be looking at the works of 3 of your peers. It will be anonymous, so it'll be double blind. You won't see the author's name, they won't see your name. Because we interact, because we have this dialogue in the discussion groups, you may be able to recognize people, but they won't know who the feedback is coming from. So we hope that helps you be candid in your feedback and allows you to give better quality feedback. That's the point of it being anonymous. At the end, in the final stage of the course, you'll also be able to tell your reviewers how useful you found their feedback, and so there will be a sort of final feedback loop in which you'll be able to give them feedback. So you'll get to know Creator. We may share the tutorials early, because some of you are already a couple of steps ahead, but basically this is where you will be working for the coming 6 weeks to develop the main project in the course. What you'll do in the community after the week 1 assignments, that's it. You'll have an activity in week 2 in which you comment on the week 1 assignments posted by other people, and then you'll be encouraged to use community for your own needs, but there won't be any additional assignments, and you will really be focusing in Creator on actually putting together your activity plan, then peer reviewing the activity plans of others, and then the final most important week of the course you'll be just synthesizing everything that you've learned and improving, refining, finalizing the activity plan to put together a final version that contains substantive changes reflecting what you're learning in the 6 weeks of the course. So I see there's a fascinating discussion going on the side, and I'm really pleased to see that this discussion is taking place parallel to my walkthrough. So I want to thank you all for your participation. You are a truly exceptional cohort in terms of the level of participation that we are seeing. This is really to your credit. We cannot prescribe this, and despite the mandatory requirements, so we're really pleased to see this and really encourage you to keep in mind that this is a 6-week marathon. So making it through orientation in week 1 is one thing, but dealing with the challenges that many of you described so clearly of having to go for field work, of having urgent deliverables that you need to get done, of having perhaps challenges in your personal or family life. You know, that is what you're going to have to just prepare, mitigate, and ultimately succeed in order to complete the course. So that's it. Thank you for your attention and your time, and for the great discussion. We're looking so much to next week's groups, but remember that the conversation really continues in the community, and we'll be following up with all the questions that you shared during the chat, the ones we were not able to get to. Again, thank you very much. Warm greetings from Geneva, Switzerland. I'm now going to unmute the 25 of us who are remaining so that we may make some noise, and look forward to seeing the late joiners, anyone still struggling, actually figuring things out, and just catching up. Use the catch-up guide that's been shared, use the materials, and let us know if there's anything at all we can do to help you. Take care, wishing you a productive week.
Thank you, Reda.
Thank you.
Yeah, see you next week. Well, I hope that within that time I'm able to catch up with all that happens.
All right.
Yeah.
I'm sure you will be. Thank you.
Thank you. Thank you. Yeah. Bye then.
Thanks, everyone.
Bye. Bye.
Bye. Bye. See you next time.
Great. Here, general results were obtained as the first randomized.
Yeah.